Grandkids, eh? Hello, my name's Nick Chitty and I run Nick Chitty Hearing Care down here in the beautiful coastal town of Auricular, North Devon. But I've also been a tinnitus sufferer. Having had 2 bouts of cancer, one in the 80s, one in the 90s, left me with tinnitus, although I'm fighting fit now. But as you can imagine, being in the hearing care profession, I get the opportunity to explore lots of different strategies to try and help patients to cope with tinnitus. I've had some success with tinnitus maskers. I've had some success with clinical hypnotherapy. But for the last 5 years, I've been studying auricular acupuncture, and I am convinced that the NADA protocol, which is 5 auricular acupoints on your ear, is truly a system that I can use to help my patients. So what I'd like you to do, this is a very short video, just follow me through with this and I'll show you how I think I can help you. After a detailed consultation, the next thing is we'd look inside your ear canal with a specialist camera. What we're trying to do is to eliminate any possible causes of tinnitus in the outer ear. This ear is a perfectly normal ear with normal anatomical features. The next patient I'm going to show you is a lady who had a little bit of cotton wool mixed with wax, was resting up against her eardrum, and that was causing her tinnitus, and we managed to remove that quite easily. The next patient had had a very heavy cold, and unfortunately, instead of blowing his nose, had done rather a lot of sniffing and giving himself middle ear infusion. This was causing his tinnitus. I referred him back to his GP. This gentleman had tinnitus and discomfort after a long flight. This is an inverted eardrum due to the fact that his middle ear has not equalized properly. This last patient had surface ear, was completely unaware that he'd got exotoses, and that's what was causing his tinnitus. All of these things we need to eliminate before we go further. The next step is to do a hearing test, a full diagnostic assessment, and for this we'll be using a diagnostic audiometer. And we won't be using headphones, we'll be using something known as insert ear tips to give us accurate readings. And if we can, we might even be able to scale and get some idea of the volume and frequency of your tinnitus. When we've got all these results, we'll pull them all together and we'll sit down and we'll discuss the best plan of action. Well, as you can see, it's pretty comprehensive testing. Now let's talk about the auricular acupuncture. I'm a NADA practitioner. What does that mean? It means I've done the NADA course. The NADA course is a strategy or protocol that was developed by Dr. Michael Smith in America, originally to treat drug users. But it's a very, very powerful tool. And it's just 5 simple points with very, very tiny little pins inserted into specific points in the ear. As a NADA practitioner, I've not only helped patients with tinnitus, but I've helped patients with migraine, PTSD, anxiety, and the side effects of cancer treatment like the hot flushes, sciatica. So if you think auricular acupuncture is for you, or you know somebody that you think it would help, then please give me a call or get them to call me on 07 557 053 157, or check out the details on my website. That's www.nickchitty.co.uk, or check out my Facebook page. That's Nick Chitty Hearing Care. And just remember one thing, I'm not going to be saying to you, I'm afraid you have to learn to live with it.